Today I am going to talk about bronchial asthma. This is the season where there are increasing cases of bronchial asthma. So, what is bronchial asthma? Bronchial asthma is a condition where there is hyper-responsive of the airways. That means the airway diameter will reduce in the diameter will reduce because of some allergens or some infections or some anxiety or some fear. Especially it happens during this season, that is during winter season. So what are the symptoms of asthma? So when you have that airway constriction, the symptoms of asthma are very simple. Like we have cough, chest tightness, difficulty in breathing, which will change over intensity and frequency, depends on the season, exposure to cold and the timing of the everything. So this is bronchial asthma. What you should do when you have bronchial asthma? You should visit a nearby doctor to evaluate you for bronchial asthma. Some patients who doesn't have bronchial asthma can also have these symptoms. So you might have this doubt why people without bronchial asthma also has this kind of symptoms, because after any infection, for example any COVID infection or any infection that pertaining to lungs or anything per se, will have bronchial hyperresponsiveness. That means a patient lungs will behave like an asthmatic only. So those people also need to have some treatment for certain duration. So how is this, how can we prevent bronchial asthma? So as we know, we should avoid all the allergens like dust allergens, food allergens and any viral infections. All these can trigger bronchial asthma. When it triggers bronchial asthma, it is called bronchial asthma flare up or exacerbation. Exacerbations can be very minimal sometimes and they can easily recover, and sometimes it can be very intense, which will require hospital admission. So don't take any chances. Whatever kind of these symptoms persist to you, please do visit a nearby hospital and a pulmonologist. So accordingly we can treat you. Once you are diagnosed with bronchial asthma, what are the medications to be used? Either we have to increase the medications, sometimes we have to decrease the medications, sometimes we have to continue the medications. So it will be decided by the doctor, not by the patient. So that, and once you are diagnosed with bronchial asthma, there is vaccination, not just COVID vaccination, there are other vaccinations also like pneumococcal vaccination, like influenza vaccination. We need to get it done to avoid further infections. So this is where I conclude my small talk about asthma. Usually bronchial asthma is we seen in young patients. Usually starts from childhood, but some people it can start in adult also. So there is childhood asthma, there is adult asthma, and as I told you, any person can have asthma like features for some time. Post COVID they can have asthma like symptoms, but that will be persisting only for some time. But asthma will be persisting mostly for a longer time, for lifelong sometimes also. Some people mostly lifetime also. There is a chance of hereditary also, that is called atopy. A person who is prone to allergies, atopy, will have atopy has hereditary prevalence. For example, if mother has atopy, child will have atopy. Next, their offerings will have atopy. Atopy means any allergy. All allergic, if we have allergy on the skin or the eyes or anywhere, or nose like allergic rhinitis, that may or may not have asthma, that patient. But most of the asthma patients, not everyone, but most of the asthma patients will have atopy. So COVID has become very prevalent, and everyone knows about COVID, including everyone, right from the guy who goes to a college, to the small children who goes to a school, everyone knows about COVID. So, and nowadays there is increased emphasis on this thing called post-COVID sequel or long haulers, or it's also called long COVID. A person who has recovered from COVID, either could be mild COVID also, or moderate COVID also, or severe COVID also. They are having these kinds of symptoms like cold, cough, and body pains, and memory fogging, and lot of joint pains and all, and hair fall also for some patients. This subset of people come under long COVID. So it can persist for 2 months, 3 months, 4 months post COVID. So what is the treatment options? The treatments varies from patient to patient, depends upon his symptoms. So when anyone who has all these kinds of symptoms, you have to come visit a nearby pulmonologist, or sometimes they can have neuro problems, so you have to visit a neurologist also. Sometimes they have cardiac problems because of clots and all, cardiac issues can also be there. So then you have to visit a cardiologist based on your symptoms. Yes.